Welcome to today's Facebook Live. Today's topic is COVID on the front lines, a physician's perspective. Today for our discussion, we're pleased to have with us Dr. Allison Weinman. She's a Henry Ford infectious disease specialist. She's also medical director of Henry Ford's antimicrobial stewardship program. Dr. Weinman, thank you for coming here.
Hi, Dave. Thanks for inviting me. Hi, everybody.
My name is Dave Olajars. I work in media relations at Henry Ford. A couple housekeeping items before we get started. First thing, remember to don't forget to turn on the sound, and be sure to read our disclaimer that's pinned at the top of this thread. Also, please like and share this post with your friends, family, and colleagues. And to stay informed about COVID-19 and other healthcare news, hit the subscriber button below. One other note, you may have noticed that Dr. Weinman and I are wearing these white little ribbons here. Henry Ford is part of the White Ribbon Project. And we encourage everyone out there to support healthcare workers and first responders during the COVID-19 pandemic. Now, you can make these ribbons at home, of course, but we encourage you not to go to the local craft store and buy materials. We're all supposed to be sheltering in place, as we know. And so we've actually made things a lot easier for you guys. And you can download this white ribbon template on our website, henryford.com/coronavirus, and print it right from our website, and you're ready to go. Other than that, we're ready to get started. Dr. Weinman, you've kind of been on in the thick of things for several weeks now. To start off, I'd like to if you could give us some perspective about the division of infectious diseases and the types of things that you guys see and treat on a regular basis at Henry Ford.
Okay, that's a good question, Dave. Infectious disease isn't very well understood by a lot of people, so I'm glad to have the opportunity to promote what we do. So, a lot of people end up getting infections, whether it's a community infection like meningitis or pneumonia, or a urinary tract infection that's severe. We see those patients that come into the hospital if they're severe. For less severe cases, internists can generally handle those sort of problems. We also see patients who have very severe hospital-acquired infections. So it's a small percent of patients that get infected after procedures, for example, but we see those patients. And we see patients that are complex transferred from other institutions who need a higher level of care. As well as that, many of us on a day-to-day basis are involved in many other things that are more behind the scenes, like infection prevention and control. So many of us are very involved, and that's things like down to looking at the disinfectant that we use to clean our rooms, up to ensuring that people know about personal protective equipment, or PPE, as we've all learned way more than we needed to know about the public than before, to make sure that that's appropriate. So we do lots of things. As you mentioned, I'm in charge of stewardship for the system. That's using careful antimicrobial use. That's being used widely. So antibiotics, we're running out of them. There's a drug shortage. There are resistance issues. And that's also for patient safety. As well as that, many of us are involved in research, global health, and many other things. So apart from our day-to-day seeing patients, we're all involved in multiple other things which have kind of been amplified since this epidemic.
How does COVID sort of stack up against the various diseases that you guys see?
Yeah, so COVID is, and I hate to use a word that's been used a million times, unprecedented. And the reason why it's unprecedented is that it's an infection, a novel coronavirus. We've had others in the past like MERS and SARS, which kind of fizzled out and we didn't really see many cases. This is different in that it's quite infectious between people, as well as that nobody has natural immunity to it, and there's no vaccine or established treatment for it. So it makes it quite a different level than the other epidemics that we've seen in the past.
We're hearing that somewhere around 80% of most people will develop mild symptoms. What do those look like? What should people be looking out for?
Yeah, so, I think that's a big picture that's really important for us to remember, especially people in healthcare. You're hearing in the media and being surrounded by news about the worst case scenarios and people that are severely ill. And I just want to remind people that that's not the total picture of this epidemic. That's what's making the news. And of course, we're all very concerned about people with severe disease, and they're occupying our hospitals, and there are lots of issues, which I'm sure we're going to talk about trying to flatten the curve so that hospitals aren't overwhelmed. But the vast majority of people in America are going to survive this epidemic, and they're going to do well. We think about 80% of people, as you mentioned, have mild disease or no disease at all, and yet will develop immunity eventually to this virus. So to answer your question, it's what does mild disease look like? It really can look like almost anything. So certainly if you have a new fever, if you develop new respiratory symptoms like cough, shortness of breath, if you develop a runny nose or a sore throat that's new, it could be COVID virus, but there's still other viruses in the community. Now, because people are social distancing, hopefully we're going to be seeing less of those, but those sort of things, body aches, high-grade fevers, that kind of thing, makes you think about COVID. So it is sort of flu-like. The other weird symptom that's been well reported in about 1/3 to 2/3 of patients is this loss of smell or taste that can often happen without any other symptoms. So, and those people can be shedders and carriers of COVID and infect other people. So if you develop those symptoms and you don't have any other symptoms, it still could be COVID. So I would be very careful about those symptoms in the absence of anything else, because you could be contagious to other people.
We do have an online assessment tool for folks to go to where they can plug in some information and sort of get a sense of the type of things that they may be looking out for. Obviously, we don't want folks going to their doctor before they make a phone call, obviously to protect healthcare workers.
Right. And I guess the other point is, if you have mild disease, it's fine to reach out to your physician, but don't be surprised if they will discourage you from coming in. We are not recommending testing for mild illness because there's a shortage of tests across America. There's a shortage of the reagents. At Henry Ford, we were actually the first in Southeast Michigan to offer testing in-house, and that's been going very well, but there's always an uncertainty about supply. So we want to encourage otherwise healthy people who are at home and feeling mild symptoms. Please don't please don't show up in the emergency room. Those are pretty busy places, as you might imagine. So please stay home. If you have questions, please call your doctor or healthcare provider.
So the 80% of most people, mild symptoms. What about that other 20% then? What kinds of symptoms are you seeing, inside the hospital?
Right. So what we're seeing people come to the emergency room with is pretty severe breathing troubles in general. That's really the issue. And that's why there's been all this talk about ICUs and ventilators, because people with very severe disease, especially with underlying immunocompromising conditions, are more prone to get severe disease and get pneumonias from this illness, which can be quite difficult to treat. So if you're at home and you have mild disease, stay at home. But if you develop difficulty with breathing or in any way you're feeling more short of breath, please do that. That would be the time to present or seek the advice of a healthcare provider.
For those folks who are going to have the mild symptoms and self-quarantining at home, what kinds of over-the-counter medicines would you recommend?
Well, Tylenol's what we recommend for fever. There's been debate about whether the nonsteroidal group of drugs like ibuprofen, Motrin, Aleve are useful or not useful, and whether they can do harm. So we're recommending paracetamol or Tylenol to be used. Acetaminophen, sorry. That was an Australianism because paracetamol is the generic name in Australia. So that's fine to use. Just general symptom relief, cold washcloth if that makes you feel better, bundle up if you're feeling cold, maybe a cool shower or bath if you're feeling warm. Just general symptomatic relief.
Do things like vitamins make a difference?
Well, there's no proven medical efficacy that vitamins make a difference with any virus. There's some data that for colds and regular URIs or upper respiratory tract infections that zinc being used early might stop some virus adhering, but there's no data for that with COVID. So in general, what we're encouraging people is try and eat healthy if you can. Get some rest, look after yourself. If you wanted to take a multivitamin, one per day, don't go crazy on them, that would be just fine. But really just making sure that you take care of yourself and eat well and get some sleep is probably the most important thing.
Do we have a better sense today than where we were at a couple months ago in terms of how this infection progresses?
Do you mean in individual patients or in a population?
More broadly.
Well, we certainly know that there's been increasing spread. So initially, the strategy was to try and control, to identify a case and then isolate and quarantine. And that's always the approach with a novel illness. We try and do that. But there's obviously been a lot of person-to-person transmission, which is why we're seeing this escalation in cases. And the other reason why it's very important to socially isolate and stay home if you're not needed for an essential service, please stay home, because we really need to flatten the curve. You've heard that expression, and that really means we're trying to delay the onset of infection and these severe illnesses coming together at one time, because this is when the healthcare systems get overwhelmed.
We know that the most vulnerable patient populations are those with chronic conditions, right? But we've also seen some cases of younger people becoming hospitalized. Can you talk a little bit about, why we're seeing that at this point?
Yeah, sure. So we definitely know that from a lot of the literature that's out there that the older you are with comorbidities, like especially heart disease and respiratory problems, if you have underlying conditions like emphysema or COPD, or if you're a smoker, you're at increased risk. But we are seeing younger people, and the reason for that is, and we see that mimicked in other diseases. So sometimes when you're younger, your immune system is much more robust than when you're not 21 anymore. And so what happens is the immune system takes over, says, I've never seen this coronavirus before, I'm going to just go into overload and try and protect the person. And so what happens is the immune response actually then can become a problem. And so that's what we think we're seeing with the younger people who are in good health otherwise. It's their own immune system being robust, and sort of ends up fighting against the body and making things worse in the end.
We're like many hospitals who have restricted visitors, to visit their loved ones. Can you talk about why we have that in place?
Yeah, so that is actually one of the most difficult decisions that we've made as a system, and many other healthcare systems have made that as well. And it's really goes against everything we've ever been brought up to in healthcare about compassionate healthcare. It's so difficult to be it's horrible to be in the hospital anyway, but to be critically ill or even moderately ill in the hospital and not have the comfort of your loved ones at your side is really an additional level of discomfort. But the reason is really to protect people. So because people can be asymptomatic carriers of this infection, we really can't afford to expose anybody else, either in the hospital or people you may encounter along the way when you're coming in to visit. So it's really for the protection of other people around and for healthcare workers that we just can't have visitors. We can't have more transmission. So we're really enforcing social distancing, especially for people at risk, because family members of infected patients are very much at risk, and they may not develop symptoms for up to a week or two after they're exposed.
So in that instance where your loved ones cannot visit somebody in the hospital, we have a way around that, and that's through our Well Wishes campaign. If you can go to henryford.com coronavirus and find out more information. But we're certainly encouraging everybody out there to send their messages online, and they will be displayed on the patient's television in their hospital room. Again, henryford.com/wellwishes to find that.
And I just want to clarify that people in the hospital, can use electronic devices. We encourage them to stay in touch, FaceTime, anytime, any way they can stay in touch with their loved ones electronically would be really ideal. Phones are really important nowadays in more ways than one.
So talk to us a little bit now, Dr. Wyman, about your typical day before COVID and what it's like now.
Well, I would say that most infectious disease doctors are exactly in the same position, so I don't think I'm in any way unique, and I don't think that we're unique amongst healthcare workers. But all of the things that we normally do, seeing patients with infection, highlighting our wise prescribing of agents, highlighting our infection control and prevention strategies, have just made for much bigger, longer, and more difficult days for most infectious disease doctors. We also serve as content experts for leadership to make decisions about where the epidemic is heading and where we ascertain there may be a potential for difficulty. So I think that's a very important part. So most of us are involved in leadership calls and conference calls quite a bit, as well as our other responsibilities. So most of us have been putting in pretty long long days and nights. And again, I don't think that's unique to infectious disease. I think there are a lot of other healthcare workers in the same position, but it's certainly focused on infectious disease and the need for infectious disease doctors and pandemic responsiveness.
We have a question here from Shelley. Do you think it's possible that COVID-19 was here in December or even January? She was extremely sick with the flu, she says, and had some respiratory issues for about 2 weeks in early January. And she's just wondering, is it possible that this virus could have been circulating in Michigan, several months ago?
Yeah, hi, Shelley, right? Yeah. I'm glad you're feeling better now. It's hard to know. We think probably there was some community spread with travel and global health and people moving around a lot. So it's very likely it was present in Michigan before the peak. It's hard to know exactly when. And the trouble is this occurred right during our influenza season when we were also seeing a lot of influenza. And influenza can look identical to this, so in terms of symptoms. So it's really hard to know, especially in retrospect, unless you got a flu test that was positive, which would help you. Even though the two could occur together, we think it more likely that people tend to get one infection at a time. But now the flu season is going down, so most of what we're seeing is COVID instead of influenza. But it's hard to tell in retrospect.
Can somebody test positive for both flu and COVID?
They can. We actually didn't see, I'm trying to think if we saw any cases, I'm trying to remember, but it has been reported as a co-infection, but I don't think that we've seen any in the hospital. I may be wrong about that, but I don't think we saw any.
Do we have a sense of why some cases tend to be sort of much more worse than others?
Yeah, again, it's really a host issue. We all have never seen the virus before, so either we have a very robust immune response to it, or as we get older and have other comorbidities, those people tend to get worse. So we know sort of the general groups that tend to get worse, but it's in an individual person, it's a little bit unpredictable how they're going to do. So we really want people who have mild disease to really be on top of their symptoms at home, and if they're concerned, to seek help.
Dr. Wyman, can you talk a little bit about the isolation issue, as well as the incubation period? Is that, we've heard 2 to 14 days? Is that still in play based on what we know now?
Yes, that's pretty much what we know now, and that's the problem, is that a lot of people are walking around asymptomatic who've already been exposed and could be shedding virus and being contagious even during that period. So that's one of the concerns.
Smoking, I trust, makes it more challenging for those who may be testing positive.
Right. So, if you smoke, and, we would always encourage you for so many reasons to stop smoking, this is just another reason. And that would include things like marijuana, weed. I would, recommend that those people are still hurting their lungs by smoking. So the longer you can be away from smoking, the healthier your lungs are going to be. So if you do one thing apart from stay home, which is not an easy thing to do because people are bored and then it's when they smoke and want to smoke other things as well. So if you can stop smoking, that's big help.
And do you include vaping in that?
Oh, definitely vaping. I should have included that. I was talking to one of my patients about vaping yesterday, actually. Yeah, vaping is included. So anything that you're bringing into your lungs that is not air is probably not a good thing.
So if somebody tests positive, they're going to self-quarantine at home in the instance where they're going to be in that situation. What's a good frame of reference then for them to feel as if, okay, they can start uniting again with their family? This is a question that comes in from Amber.
Yeah, hi Amber. These are very fraught questions. So we kind of go by CDC guidance. So if somebody's symptomatic, we would recommend whether they have a proven COVID test or not. We would want people to presume that they have COVID and try and self-isolate from their family, which is really difficult to do in certain houses. So we would recommend, if you can, separate bathroom, separate bedroom, don't have meals together as a family. And we would recommend that you do that so you have to, either for 7 days completely from the onset of symptoms, and you have to have included in that 7 days 3 days of recovery. So if your fever goes for 3 days and then you stop having fever and your cough starts to improve, then 7 days would be the minimum time. But we also would consider that person to be possibly infectious up to 14 days. But the self-isolation, it's sort of a judgment call, but when people are feeling better after the 7 days, they should still self-isolate at home.
So kind of take us on the inside of the hospital and give us paint a picture, if you will, of what that looks like from on the healthcare worker side.
Yeah, so healthcare workers are the same as anybody else. We come to work and we obviously put our patients first and we care for our patients. This has got an extra level that I haven't experienced in healthcare before, even in infectious diseases. And that's that we're all frightened for our families. I think people are less frightened individually and much more frightened that they're going to bring this virus home to their families, because we're seeing the sickest patients who are shedding the most virus. And as you know, there's lots of concerns about supplies of PPE. There's ongoing issues with people being infected in the hospitals, in all healthcare settings. So I think that that anxiety is definitely there. I think the culture at Henry Ford is truthfully very positive. People are turning up to work. They're doing their job. They're getting screened before they come in with either temperature checks or symptom checks to make sure they're not bringing infection into the hospital. Our healthcare workers are all wearing masks, surgical masks, just to protect themselves, at a level of protection from perhaps an unsuspected patient who could be positive. I think people are going about their jobs. They're busier than ever. We have some staff shortages because of illnesses that we are compensating for. As you know, we've closed a lot of our clinics. We're doing telehealth and telemedicine and phone medicine and all different ways of communicating with our patients. So we've got extra personnel that can be redeployed to where they're needed. But I got to tell you that if you know a healthcare worker or a first responder or anybody who's involved in healthcare, any support you show them is so deeply appreciated. You wear a ribbon, it means something to us. Just a thank you, reaching out on social media. Personally, I've been deluged with thanks, and it's not just me, it's all of us, and it means so much when somebody reaches out and just says thank you. We appreciate what you're doing. It's just incredibly gratifying, and we appreciate all the, if you've seen those videos of the applause for healthcare workers, that all really, it sounds crazy, but it really means something to us.
As we talked about earlier, we do have this white ribbon template on our website, henryford.com, as part of our white ribbon project. Feel free to go to our website and download it, print it off, wear it. Put it on your car, get creative out there, but please do not go to your local craft store. We want to shelter in place, right? A little bit about PPE. Do you feel does the staff feel safe wearing the PPE, Dr. Wyman?
Yeah, so I think, we're all very accustomed to using PPE for lots of isolation rooms in general. We're all pretty accustomed to it. It's a little bit different than that. There's a little bit more PPE that needs to be involved in these patients. So I think we've been very good about disseminating. We're all really visual. We like to see a demonstration. So I know that the infection control practitioners have been really robust, and multiple ID doctors have been robust in going out and doing demonstrations of donning and doffing, putting on and taking off. And one of the risk areas is when you're taking off that you can contaminate yourself. So I found it useful. We had a refresher course. I found it useful. So I think once you've got it on properly, I think people do feel that they are protected because there's good science behind the protection. The type of masks that we're wearing in the rooms, the face shields, the gowns and gloves, the hand hygiene, all that matters. So I think people do feel safe with the PPE, and I think that's one of the reasons that there's anxiety about shortages nationally about PPE, because without those protections, healthcare workers could be exposed unnecessarily.
So when you go home after a long day, how do you doff your clothes?
My clothes. Well, that's a very personal question, David. But what we're sort of telling people and first responders is, I usually try and make most of my house sort of a relatively clean area. I would take my shoes off and leave them near the door. I would take off the clothes I had worn to work. Certainly the outer clothing, I'd take it off at the door, put it in the washing machine, and then go up and have a shower. And then obviously, Nothing's 100%, but that's a very good thing to do. If you're a first responder and you have a bag, it'd be good to wipe it down, maybe take your clothes off if your garage is attached to wherever you are. But just try and do some basic hygiene before you mingle with the rest of your family. And I think that also gives us a sense of security. Even though these are not major transmissions from people's clothing, we do worry about it. So I think that's what most of us are doing, some variation of that recommendation.
Question coming in from Allie. If you are symptomatic, how long can you be potentially shedding the virus?
Yeah, well, that's another problematic area where data is still coming in. So we think most people stop shedding about 14 days, and definitely the more severe your illness is, so if you're in the hospital or if you're immunocompromised like a transplant patient or you're on medications to suppress your immune system, you can shed for longer. And so obviously the hospitalized patients, we actually don't know. There's been a little bit of data that the median time is up to 20 days of shedding, but for otherwise healthy people, we think probably around 14 days is probably the median period of shedding. But because we don't have the capacity, nobody in the nation does, to test everybody to be sure they're negative at the end, we're really just going by symptom resolution and just the CDC recommendations of 14 days.
In terms of, you've mentioned the flattening of the curve. Put on your sort of hypothetical hat here. Where do you see this going in terms of flattening the curve?
Yeah, so remember the infections we're seeing today are not today's infections. Most people got infected up to 2 weeks ago. So we're still seeing what was going on about 2 weeks ago, and the days are kind of blurred to me, and I forget when Governor Whitmer put in place a protection order, but I think it's just right around 2 weeks at the end of this week or the middle of this week. So we're not going to really see the effect in Michigan of social isolating for a little bit of time yet, and we expect the cases to still increase for now. So, like I said, all we can do is the thing that is in our control. There's so much about this that is not in anybody's control, but the thing that is definitely within the control of every one of us is to socially isolate and to stay home. No question about that. And that there's good data to support that. It's the only way that we can really protect ourselves until a vaccine is around, which may be, many, many months away yet. So please stay at home.
Another question, this one from Becky. Are you seeing significant lung damage in those patients having the virus?
I'm not sure what you mean by lung damage. Do you mean long-term lung damage, or in the short term, certainly the pneumonias we're seeing and the lung infiltrates we're seeing are short-term damage. It's really not clear yet if there will be long-term lung damage in some of these patients from this virus. We just don't know that yet. We just don't have enough experience, and nobody in the world has a long-term follow-up yet.
So in terms of this, how about the morale of the healthcare workers? You talked, some of what's going on sort of behind the scenes. Give us a read on what the morale is like on your team and other parts of the hospital.
Well, I would say the infectious disease morale is pretty good, because we are a group that likes to do things like all of us in healthcare, and so we are very busily meeting, planning, putting together protocols. So I think we're okay. I think the important thing, and I think the rest of the healthcare workers, I think it kind of depends on the day of the week and who they're looking after that day and how difficult their day was. But I think in general, obviously nobody's really happy to be at work, and nobody's really happy to be seeing this hideous epidemic. But I think that, we are sticking together. I think one of the things that's been very helpful for me personally is to speak to other colleagues involved in this. That's been extremely helpful at other institutions as well as at Henry Ford, to get that support, to be reminded that we're seeing the worst part in the hospital, and to keep that perspective, because often we tend to lose perspective. So I think people are holding it together. I think it's a difficult time. It's challenging. So I know that so many of us are talking to each other on a daily basis, and that's very, very helpful for individual people. And of course, the support of our family and friends is just amazing. However you can reach out is very appreciated and makes a big difference to one's day.
In your personal downtime, sort of walk us through what's that downtime like for you away from the hustle and bustle at the hospital? Yeah,
so a lot of us are doing some of our work at home, because there's a lot of committee work, there's a lot of meetings that are taking place via Skype, obviously remotely, trying to keep us all safe. So there isn't a huge amount of downtime, I have to say. I am learning to be a little bit better about that, but as things, become more protocolized and more clear about the direction that we're heading, and we get more information from elsewhere, I think people are having a little bit more downtime. So I am trying really hard, personally, to try and eat healthily, the things I just talked about before, try and get some sleep, which is a bit difficult actually for me at the moment, having trouble this week, and to exercise. So it's really important that people, it's fine to go for a walk. It's fine to go for a walk with a friend. Just keep 6 feet between you. And thank you, shout out to all my friends who've walked with me multiple evenings late. We tend to, there's not much traffic now. One of the advantages, we tend to walk on opposite sides of the street. It's about 8, or I don't know how many feet it is apart, but it's way more than 6 feet. You can still have a conversation, but it gets you out there, and you've walked a few miles before you realize, and it's very therapeutic to sort of vent. And I've spent a lot of time, my downtime is mainly spent with connecting with family and friends. Right now, my husband is a critical care doctor in Boston, and he usually commutes home, and he's obviously caring for sick COVID patients there. My son-in-law and daughter, who live close by, are both first responders. My son-in-law is a paramedic, and shout out Mike, you do a great job, and to all of your team members, and you do an amazing job. My daughter is a psychiatric social worker, and she is doing telemedicine to look after the mental health of people, and the number one problem she's definitely seeing is anxiety in the community. So my whole family are sort of involved in this, and so connecting with them multiple times a day is very helpful for me, as well as all my friends and family.
You shared with us earlier that you just had a birthday recently.
Yes.
And given the stay in your home order by the governor, this was a unique birthday party celebration that you had. Can you kind of share with us what that was like?
Sure. I don't really want to share the number, but I'm happy to share what we did. I was expecting really nothing. It was just kind of a normal day, and a dear friend of mine, thank you very much, you know who you are, arranged in cahoots with my daughter, who is home, my son-in-law was working, and my husband's in Boston, to have a bunch of people come up in their cars, decorated with signs, and everybody came out in my lawn. I stood a very long distance away from everybody, and everybody socially segregated 6 feet apart. And they all sang, which was lovely, sang happy birthday, and thankfully weren't washing their hands at the time, which that song is now forever embedded in my mind as the hand hygiene song. And we just were able to talk even though we were a long way away, and our neighbors came out, and it was passersby said, oh, it's nice, and they left streamers and balloons outside on my lamppost. So it was a really odd, surreal, unique birthday, and it was definitely the high point of my probably this entire time, was just the fun of seeing everybody and enjoying them, and so it was pretty unique, but it was fun. Thank you all, everybody who showed up. It was really heartwarming.
Very cool, and thank you for sharing that story. But there's a message behind this, right? For everybody who are going to be celebrating birthdays coming up, and they should follow what your friends had planned for you.
Right. So quite apart from the fact that you really can't lose connection with everybody, because that's the thing that keeps it. We're all in this bad situation together, and so it's really important to maintain contact, either electronically, but in person is okay as long as you're outside is preferable. But I don't want people going into each other's houses. That's definitely a bad situation. But outside to congregate, not congregate together, but 6 feet apart at least. Obviously, anybody who's ill shouldn't participate in that at all. If you have any symptoms, you shouldn't be at anybody's house. You should be in your own house. But limited social contact, 6 feet apart. I mean, it wasn't very long. We were just out there for maybe 20 minutes, but it was a lovely day.
This is a question from Pat, and going back into the hospital now here, she's asking, so, walk us through sort of your day in the life, from the time you walk into the hospital and when you leave. What?
Yeah,
Describe for us what that looks like.
Every day is a little bit different, and it depends on exactly what your responsibilities are. But for the ID people that are seeing patients, so most of us start off the day with a very early meeting. The ID people in the healthcare system, across the healthcare system, speak to each other every single day. Different groups of us meet, so the people involved more in infection control and prevention and stewardship would meet. We meet first thing in the morning, and then there's we have a meeting at noon with the Henry Ford Medical Group Infectious Disease Division. So there are a lot of meetings interspersed where then different teams are deployed throughout the hospital in infectious disease. Some are going out to the teams where the COVID patients are being admitted and giving advice and running by what we think is best practice. We're constantly helping with infection control and prevention measures, thinking about PPE. People are constantly coming up with questions or calling us, emailing us, texting us. So it's normally pretty hectic in the hospital. Hospitals are not very relaxed situations for most healthcare workers. But the number of phone calls, questions, and some of them are from our colleagues, a lot of them are from our colleagues, concerned about their families, concerned about their own status, concerned about their patients. So a lot of what we do is go out on the floors, give advice, as well as seeing patients and looking after them. Again, there are meetings throughout the day where we want people to be up to speed on what is best practice now, what happened since yesterday in the hospital, what's going on with our global hospitals and our healthcare system, so that we all have a picture of what's going on. And then most people usually have another few meetings, and then people are leaving later and later and getting home late. And then there's the issue of getting cleaned up before you go see your family. So the days are just longer, I think, and there's more questions that are happening later in the evening. So of course, if somebody calls us, we're not going to not answer. Also, our patients, of course, are concerned. So we all have our own patients, I have my own clinic patients, so they've been reaching out via their MyChart messages, and so responding to them, calling them, setting up video visits for patients that need to be seen for other non-COVID conditions or other things that are going on. So it's very busy and hectic, I guess, would be the answer.
This is a question from Chris asking about sleep, and this may be a little outside of your expertise. For those who are having trouble getting to sleep, any recommendations from an infectious disease doctor like you?
Well, I would love to say have a big glass of alcohol, but that's not the right answer, and I'm not saying that. So all the sleep doctors say the same thing. Try and get at least 7 hours of sleep a night. Make your room just a sleep room. Stay away from electronic media. Don't check out COVID sites, and don't look at social media. Make your bedroom just where you go to sleep. Try and make it a relaxing space for yourself, and try very hard. There's all kinds of breathing exercises that pop up online, and meditation, which actually can be very helpful. There's a bunch of apps too that kind of wind you down. I know there's a few that will read you a bedtime story. Some of them I've listened to one of them, and I fell asleep right away. It was obviously either very boring, I was very tired. So all those sort of things you can do to help yourself sleep, and stay out of the bedroom until you're really tired, and try and go to bed at the same time every night. I think everybody would agree that's a good thing to do.
What's your average sleep time for these days?
It's hard to say. I have not been sleeping well. I think I'm not the only one. So I think I'm trying to get in about at least 6, trying to get 7. If I have an opportunity to take a few minutes of nap during the day, I do. I haven't really had an opportunity to do that. But I think it's interrupted sleep.
As we know, there's a lot of misinformation out there on the internet. Talk to us a little bit about how people should process information out there, and in terms of, and from your perspective, what's the biggest misconception about COVID?
Well, there's so many, Dave. It's hard to pick just one out. I think the biggest misconception, is that the importance of social distancing, and I hate to harp on it, but it really is the most important message, is that it's overrated, and that people are panicking about it, and this really isn't an epidemic. This is an epidemic. It is a worldwide epidemic, and it's serious stuff. And even though only about 20% of patients are going to get sick, and a smaller percent really sick enough to be hospitalized, and even an even smaller percentage are going to pass away, if you look at global numbers, and if you even look at the American numbers, those are frightening statistics. It is not overrated to stay at home. It is not overrated. So I can't emphasize enough that when I see on social media where someone says, oh, I went to someone's house for dinner, please don't do any of that. The more we socially isolate, the more extreme measures that we can take, the more effective it's been in other countries. Other myths are about, crazy things I've read about stopping getting infected. These are all nonsense, about gargling certain things. So I would say that, there's one source of truth there's several sources of truth, but I would be very careful what you read online and social media. So cdc.gov is an excellent website that's updated regularly with interim guidance. That is a source of truth. Dr. Anthony Fauci, who's been on those national press conferences, he is a very well-respected and well-regarded and well-known. We all know Tony Fauci. He's an excellent source of information, so I'd listen carefully to what he says, but it would need to be one of those sites. If you are hearing something and you're not sure about it, please reach out to somebody who would know, like an infectious disease doctor, or send emails to the CDC to get accurate information, but please just really be skeptical about where you're getting your information from. And just because it's on social media, as we all know, it's not always right.
It's a question from Pat. We know that everybody should be washing fruit and vegetables before they, eat them at home. Anything that we need to be doing differently with COVID?
Yeah, so the whole home delivery thing if someone's dropping off, food to you, what do you do? And really, we're much more concerned about what we know is a source of transmission. So even though you can identify virus for differing number of hours to days on certain substances, it's not clear that's been associated with a lot of transmission. So what we're focusing on is symptomatic patients or patients who have early symptoms being shedders, and they're the source, and that's why social distancing is so important. Groceries are difficult, and I know there's been a lot of stuff out there about, you have to wash with your fruit and vegetables, soap and water, and, I think this is kind of overkill personally. I mean, I got to say, when I have a few friends, thank you again, who are being kind enough to deliver groceries to my house, leave them on the porch, and then go away. And so I bring them in. I don't leave them outside for whatever the advice was, a week, or I can't remember what the advice was. I do tend to wash down, if you have wipes, anything that's in plastic or any outside wrappings. And I use hand hygiene after I touch new groceries and things. But for fruit and vegetables, I just wash them off as I always do. There's always bacteria on fruit and vegetables. Peel fruits that are peelable. You might want to do hand hygiene after peeling. But again, I think that's kind of overkill. I think you can go really, there isn't a lot of data for transmission from foodstuffs.
This is a question from Debbie. What's your biggest challenge as a doctor in this environment?
I think it's maintaining a sense of proportion and keeping in mind that we're all worried and anxious and stressed in our personal lives and our professional lives, and that's adding to a difficult job. So just trying to keep in proportion, reminding myself that we are not the only ones going through this. This is a worldwide experience, unfortunately. And that we're going to get through it, and the vast majority of people are going to be okay. It's just this. I think it's a challenge of dealing with various stages of stress and dealing with concern you have for people that you love, and as well as for your patients.
We know that since this pandemic started, there's been a lot of moving parts in terms of the criteria from the CDC as well as the Michigan Department of Health and Human Services. How do you guys sort of keep up with the fast-moving, changes in terms of information?
Yeah, and it is really fast, and that's why a lot of people are getting confused and think it's very chaotic. And the reason it's chaotic is we actually at Henry Ford, we have incredible leadership here, I have to say. And so even though it seems very chaotic and things are changing, it's because the data is changing so quickly and we're becoming more knowledgeable about it. So that's one of the reasons we have a lot of meetings during the day, because things might have changed from yesterday. The CDC might have changed their recommendations, which might affect what we do for our whole healthcare system. So we all have to, as well as doing all the other things we're involved in, keep up with what's the latest. Many of us reach out on a daily basis to people around the state, other infectious disease doctors, national Societies are really helpful, where there's all these chat rooms on all these infectious disease societies. Everybody posts their tricky questions. There have been webinars for national infectious disease doctors, and then internationally people are in touch with each other. So people are getting the data as quickly as they can. People are trying to come out really quickly with publications in the medical literature. And we're all trying to keep up and sharing those articles so that we're all on the same page and we keep up as much as we can. So it's kind of a group effort to keep up with what's new.
Before we ask you to offer some closing closing remarks, excuse me, just a couple of reminders for information on our patient hotline. You can reach them at 313-874-1055. That number can be contacted from 8 a.m. to 5 p.m. Monday through Friday. We talked a little bit about the online assessment tool on henryford.com. So if you're looking to sort of give yourself a quick test on your symptoms, feel free to try out that online assessment tool. The White Ribbon Project, Dr. Wyman and I are wearing these white ribbons. Go to henryford.com and download your template. And as we stressed earlier, please do not go to your local craft store to make these ribbons. Get creative at home. Put a big ribbon on your car. We see a lot of those during Christmas time with reindeer ears and whatnot. And then finally, the Well Wishes campaign. If you have a loved one in the hospital, shoot them off an online message and we'll make sure it gets to them in their patient room. So thank you for all that. Dr. Wyman, any closing remarks here moving forward as we anticipate this surge coming our way?
Yeah. So, I think it's really normal to be worried. I think this is a worrying time for everybody. I think it's really important, again, I think if you take away one message, it's social distancing. We really need to flatten the curve to allay some of the concerns in the hospital with shortages and just physical patient loads, and to relieve our healthcare workers. So social distancing, be kind to your healthcare workers, as we should be to all the people that keep our society running right now, the grocery workers, the postal workers, everybody who picks up your garbage. Everybody is really playing a role and everybody's frightened. And I think if we can derive any comfort, it's staying as connected as we can, even though we can't physically touch anybody outside our household, to stay as connected as we can. And we're all in this together, one way or the other. And again, the majority of us are going to be just fine. But it looks like it's going to be a bit more of a marathon than a sprint at this point. And just hang in there and hang in with your healthcare workers.
Any special advice for folks workers in grocery stores who work for the governments, who pick up our trash every day and things like that? Should they be doing anything special on their end to protect themselves?
Dave, that's a really fraught question because I'm not involved in some of their PPE preparation, and I would just caution them to use the same precautions we're recommending for everybody about social distancing, and they should consult their own companies and whatever for whatever additional advice they should be given.
Well, Dr. Wyman, we really appreciate you coming in and sharing your insights. This has been great information today. Thank you. Keep up the good fight for us.
Thank you.
Stay safe.
Definitely team effort.
All right. That'll conclude our Facebook Live for today. Thanks for watching.